We did this huge study, 215 people. I don't know how many people actually went to the university and picked up their free bottles. I don't have that data. But what I do know is one doctor found such a profound effect in her patients that she went through all the trouble to reach out and say, please, let me have access to this product for my patients. I love what it did. I love what it's doing for them now. And I want to bring this to my island. I'm hoping that for those who this will work for, it will make a difference. It will really make a difference. And we do have diabetics who use glucose stability with their diabetic protocol, their diagnosed prescriptive protocol, and they are seeing that they can decrease their load, their medication load, which is great.
Hi, Jamie. Welcome back to another episode of For Life. Good to have you here.
Hi, Niki. It's good to be here.
Well, we have had quite a discussion on blood sugar diabetes. Today, we're going to dive in a little bit more into the study that LifeSeasons ran on one of our formulations, glucose stability. We ran a study in Grenada, and I'd love to give the listeners a little bit more insight of what that study was about.
It's interesting because it was our kickoff study. LifeSeasons had not been able to afford, quite frankly, to run their own individual research studies prior to 2011. And once they had the ability, it had been a dream of Darren's since the very beginning that he always wanted to participate in original research. So he hired me to make that happen. And our first approach was Grenada because they have a great research center called Windruff, which is part of St. George's University Medical School. So they were world renowned and well published. And so we partnered with them to do some studies with us. It was a good experience. It ended up being a tri-partnership with LifeSeasons being the sponsor of the study, and then the study being independently ran between the Ministry of Health in Grenada and the University of St. George Medical School's Research Center, which is called Windruff, the Windward Islands Research Center. So they ran those studies independently. Now, I was there in the beginning as we went back and forth on what type of study we wanted to run, because we went in with our eyes open. Grenada is known as the Spice Island. So we love the idea of running an all-natural supplement trial in Grenada because the Grenadians themselves love herbals and spices and are well bought into that culture. And their open market there, if you haven't been there, is amazing. You can take a spice tour, in fact, where they'll take you into the jungles and forests and farms there that are cultivating the different herbs. And you can take cocoa off the tree and cut it open with a machete and eat the cocoa nuts. And you can strip cinnamon bark right off the tree and suck on it. I mean, it's amazing. It's a beautiful, beautiful island. And I loved my time there. So going back to why we chose glucose stability, we had this product. It was called Diabetic X when we started. And I talked to Darren a bit about that because the Diabetic X title insinuates that we're treating diabetes, and we are really about prevention of diabetes. And so we changed it to glucose stability because that's what the product really was about, was helping people balance their glucose and then helping their body utilize the glucose that they take in better, or blood sugar. We can say the sugar that they take into their body, that it's utilized better by the body. The cells become more absorbable. They're able to take that in. They're more, and then the blood sugar is able to, the kidneys are supported, so they're able to flush better. And so it's just it's a product that is very supportive of the way blood sugar is used in the body. It supports the pancreas, the kidneys, and the cellular. I had a meeting with the Ministry of Health from Grenada and the head of the research center, and we talked about the diagnoses there in Grenada, the challenges that Grenada is having with health, and they kept coming back to diabetes. So that's why glucose stability was chosen. Diabetes is an epidemic disease across the world, but it has hit Grenada particularly hard. And
so, Jamie, I just want to I'm curious. Did we pick Grenada before we determined? This is from what I'm understanding. We picked Grenada before we determined that glucose stability was the product of choice.
Yes, because we wanted to go in open to what they need. So meeting with the Ministry of Health gave us an opportunity to listen and learn and find out what would be most beneficial for his island. And so we went through all of our formulations at the time. We've added, of course, many more, but this was the one that he kept coming back to, that this is the one that they were the most interested in. So, of course, this is the one we chose to do research on in Grenada because of Grenada at one time was such a pure island, and then we introduced fast food and the American lifestyle to the islands, and diabetes has just gone out of control, unfortunately. So he was very interested in seeing what that would do.
Were there any other major contenders? I'm guessing Cholesterol or maybe BP stability, or was it pretty predominantly glucose stability?
No, it's interesting that you should say that because at the time we had, there was a condition that was in the literature but not medically recognized as a diagnosis called metabolic syndrome. And metabolic syndrome is like prediabetes. It's a precursor to many disease states, but it is overall driven by blood sugar and lipids, high lipids, which also blood sugar is a driver, a risk factor for lipids and heart disease. So they suffer severely with metabolic syndrome. That was the first thing that we recognized. Even though at the time, metabolic syndrome was not a medical code, a medical diagnosis, which is why we could use it in our protocol language. But it is interesting enough. I just looked it up. October 23rd, 2023, the medical literature has now assigned an ICD code, meaning it is now coded in the medical records as a diagnosis by physicians. So, and can be billable to Medicare and insurance. So metabolic, we were kind of before our time, just from the literature that was being published. But it basically means you have a certain, a widened waist, you have high lipids, you're pre-diabetic, you have hypertension, and you're obese. So five criteria to meet metabolic syndrome. And the islanders in their health records were showing that was a huge, metabolic syndrome was a huge problem. And we looked at blood sugar. We started looking at those 5 components to see what we thought was the greatest driver. And of course, we want to simplify this down to something that we can measure. So we thought the greatest measurable driver to that risk was high blood sugar. Okay. So, and this was just something. We had physicians there. We had the Ministry of Health. We had the university research team. So that's what they concluded.
Okay. And unfortunately, it seems like with those 5 underlying things that you need to meet in order to get the diagnosis of metabolic syndrome, it seems like that's easier done now than it ever has been before. I was listening to a stat yesterday that I think was 60% of adult Americans are overweight. 33%, like it's not as difficult now there's such a majority of individuals that probably can easily meet that standard of metabolic syndrome.
Yeah, I don't know what the current numbers are because back when I was writing this and working with them to develop it, we didn't have numbers on metabolic syndrome. It was just starting to be verbalized or printed in the literature. So as a syndrome. So we didn't have all the numbers that we have now. So I imagine we could look at those numbers and see the percentage of Americans that are suffering from metabolic syndrome. I imagine that now the data is there, especially now that it's a diagnosis, a billable diagnosis. So, but anyway, that's how we got to glucose stability. And then when I shared the ingredients with the team, especially the physicians, nurses, and the Ministry of Health staff that was there, they were so excited about the ingredients. They were like, cinnamon, we know cinnamon. And in fact, several people said that was a traditional island treatment, I guess. I don't know if I should say treatment, but something that is used traditionally is that people get up and drink a cup of cinnamon tea in the mornings to help regulate their blood sugar, get them started. They already knew. They said, we know this is traditional herbal medicine that we've been practicing for generations. Nothing you're telling us when we started going over each ingredient, nothing was surprising to them. And in fact, we could go to the open market and pretty much pull every ingredient off. And we did. We went to the market and we would pull those ingredients out, take pictures. It was an exciting time because we were like, we're just supporting what you've already done, what you already know, what your grandmothers have taught you. So now we have it in a form that we're going to see how it works. So that's how it started.
Coming back to the roots of, we see this in a finished formulation, but then being able to hold it in your hand of where it started from has to be such a cool experience. Now, I'd love to explore the methodology of this study. What took place? How long did the study go for? How many participants? But I also know even before that, the selection process of finding the participants wasn't the easiest thing. What did that look like?
It was interesting. We were naive. There wasn't a lot of research being done in the islands themselves. Windruff is a world-renowned research center, but most of their research is done across the world, not necessarily in Grenada. So we were bringing something that they were excited to do and excited to participate in. So we did go in with some naivety. We really did, because we thought everybody would be excited to participate. And we wrote the protocol in a way that we thought would really benefit people, truly benefit people. So we included a Fitbit. So there was a huge education component to this. We had nurses on board that would literally do home visits and present a participant with several hours of education over time. And it was all planned out. And it was basically on good health, exercise, everything we knew that helps with the control or prevention of diabetes. And included with that was a free Fitbit that then was tagged into our system so that the nurse could go and then just collect the data at each visit. We also gave them a blood sugar monitor, so they did need to stick themselves. At the time, we didn't, blood glucose monitors were way overpriced out of our budget, but we did give them each glucose monitors that they could use, and then the nurse as well could come and check them herself. There were several labs throughout the time span that you were on the study. So we did full lab panels on people, including lipid panels and thyroid panels. And so CBC, CMP, if you even know that language, just a full, like you were getting a physical. So they would come in, get all these labs, a good physical, sign up for the study. They could not be diabetic. They could have risk factors for diabetes.
Could they be pre-diabetic?
They could be pre-diabetic.
Okay.
But they could, I'm having to think about that because we had that argument. At the time, they could not be pre-diabetic either, because it had just become an ICD-10 or a billable diagnosis, medical diagnosis. So we had to, that was really frustrating, because when we started, it wasn't. Then by the time we got everything written and ready to go, it was like, nope, it's now a billable diagnosis. That's why.
So you couldn't even be pre-diabetic to.
No.
So what was it that they were obese?
Syndrome. We went strict with metabolic syndrome. So you had pre-diabetes, but there's like that just almost pre-diabetes. We took it right to the edge, right? And we had a huge population to work with. So we took it to the edge, and we said, you could have had some high hyperglycemic readings, but you can't be diagnosed with pre-diabetes. And you can, the waistline, we measured the waistline was a measurement. The lipid level was a measurement. All of those things that I just mentioned. So we had lipids, we had waistline, we had weight itself. Then we had several readings of hyperglycemia, and we had genetic. You had the genetic component as well. So there were several things. It's a huge, what we call inclusion exclusion criteria. So you were included if you met this inclusion, you were excluded if you met this criteria. And so they would come in, they would meet with the physician, they would go through all this testing, sign up for this study, receive their Fitbit, and then the nurse would visit them within I think it was within a week, would come to their house and visit with them and start the education process. And at that time,
how many participants did we have that signed up originally?
We got 25, which was like, and then within 6 months, we had 50 because word of mouth. So that was helpful. The biggest problem was our criteria, our exclusion criteria. And we kind of fought back and forth. Now, whenever you do a clinical trial, you have to go through what they call it's a board of ethics. They need to review everything. And this includes people who are medical and non-medical, and they either approve you to move forward or not. So we had already gone through that board and gotten approval, which is a painstaking process. It truly is. And then you get that approval, you get to go, everything's set. And we start recruiting. We realize that one of the, areas that we couldn't get people to sign was that they would be compliant to, commit to compliance to, was the alcohol. So alcohol is a huge driver of blood sugar. I don't know if people are aware of that, but it isn't good for your body. It's okay.
So what is it? What is it doing scientifically in the body that's affecting the blood sugar?
It drives the blood sugar up, so it converts to sugar, and it just is it drives your blood sugar way up. It's not good for you. It's also not real great for your liver and your kidneys. So if if you have those disease, so an overindulgence in alcohol itself is a huge driver to diabetes, and liver organ damage. But so what we're looking at is, we said, you could be you can consume alcohol occasionally, but you cannot consume it over certain amounts. That was also included in the exclusion criteria. And there, alcohol, especially rum, is a huge, it's part of the tradition of the islands. They love their rum. They make it and they drink it. And in fact, there's so much rum consumed in the islands, they don't even export it anymore. It's consumed all internally, and it's very high proof. So we knew that if you have metabolic syndrome and you're consuming large amounts of high proof alcohol, this isn't wine and beer, this is high proof rum, that you're not going to be able to, control your blood sugars adequately. It would fight against anything we could give you, right, naturally. So this was just something you need to commit to. You are also committing to exercise. So we wanted to do a whole full program, and saying that, not that glucose stability is something you take and it solves all your problems. It's something you take as a bridge to help you as you move forward with optimal health, right? So you want to use this, and it'll help it'll help you, but it doesn't mean you should ignore activity. We talked about that before, how important and how good you feel, Niki, since you've started so much activity in your life. And it's not something you can do and then eat anything you want to eat. Ignore all the other health drivers, right? It's something that is an adjunct to moving forward with health, is what I should say. And it has helped lots of people. I collected clinical data long before we started this study with people who were giving me testimonials. And then I would check out their testimonials, like looking at their blood sugars that they were sending me and then saying, I started your product. I started taking this formulation, and they saw improvement. They were doing things like cutting their diabetic insulin needs in half by taking this, even as a diabetic. Of course, we couldn't run a study like that, but I knew for some people that this was highly effective in helping them as they tried to progress to health and learn more about how to do that. And so that was our whole purpose of this study, was to just broaden the understanding of diabetes, bring diabetes into awareness in the island and what that does to your body, and then provide health, like with nurses and doctors, to show you this is where you're at. And by doing these things, this is where, let's see what happens to your body, and let's see if we can help provide that for you.
Great. So did
everything was provided free. So
that's fantastic. Did we end up with 50 participants, or did that number change?
No, we ended up with 215 participants, but
fantastic.
That was an interesting process too, because in the beginning, the other problem we had is only women who were signing up. None of the men would sign up. And it tended to be older women. And then they were so excited about it. They were recruiting, but people couldn't meet the criteria. They were already diabetic, or diagnosed prediabetes. So they just could not meet the criteria. It wasn't alcohol necessarily, but there were other things fighting against that. So, or they were immobile, or there were just other things that they couldn't do. So I had been volunteering at the hospital there in Grenada every time I went. I would work with they were opening up a nursing program at the medical school. So I lectured there, and then participated on rounds at the hospital. It was just something I wanted to do to give back to the community. And during that process, I met a woman who was just retiring, who was a Seventh-day Adventist. And just a lovely woman. And I was explaining the study to her to see if she could help with recruitment, like I did everyone you meet. You want to tell them, this is the study. This is what you have to do. It's really great. And you get all this stuff free. And she was so excited about it. She invited me out to her small island, which was in the Grenadines, and was quite a trip. And I went out there and met with her and presented the entire education program to her, the study to her. And she said, I will get you participants. And in turn, she provided education to me on the Seventh-day Adventists, which I didn't know anything about their dietary and lifestyle. And that was her life mission. She was a missionary in the Seventh-day Adventists, also medical, and really believed in healthy lifestyle, and was saddened by what was happening to her people. She's Grenadian and was very saddened.
Okay. Is there a big population of Seventh-day Adventists out there?
There is 10,000 Seventh-day Adventists in the islands. Yeah, I had no idea.
So the blue zones, right?
Mm-hmm.
The only location in the United States is 45 minutes an hour from my house, Loma Linda, and it's a Seventh-day Adventist community. And it's interesting. I had family in the hospital there, and I actually had friends who worked at the Loma Linda Hospital. And you go into the cafeteria, it's not food that's sold at other hospital cafeterias.
No, she took me wild crafting. It was one of the best experiences of my life, was spending a day with her. She made soup for me and homemade bread, and we just spent the day together. It was an incredible adventure. I'm just almost tearing up because I think about how much I learned to love this woman. Within a month, we were completely recruited. We were full.
Fantastic.
She really had a lot of to do with getting that done. So,
do you still touch base with her?
No, I don't, to be honest with you. 2020 happened, and I haven't been back to the islands since then. But every time I went back, I tried to. And she does spend some time in Great Britain as well. She's a dual citizen. So I don't, and she was retiring and to her home. I mean, she was leaving the main island of Grenada at that point and retiring. And so it was, I haven't kept up with her, but in my spirit, I remember her and I will honor her my whole life. So, and be grateful to her for thinking that this was a good study and worth her time. Yeah. And so we did participate, we did get all of our participants. Not all of them were able to get through it. I mean, not all of them survived the study. Not survived, they all lived, but they didn't complete it. They didn't meet all the criteria to complete. And that's
what was some of the most difficult components for these individuals?
Taking a supplement, being consistently taking a supplement every day. That would be something that a Seventh-day Adventist might struggle with because they don't usually take a lot of pills. So that was something that in order for us to collect the data and to show that what we needed to show, they had to consistently take their supplements. And we were pretty careful about that. We would deliver the bottle. The nurse would pick it up. She would count those. And of course, people are honest. They're like, no, I didn't take any last week, So, exercise. So it's all the things we know, Niki, right? Yeah. Not consistently exercising. Some did in the beginning, and then you could see by their Fitbit, they just kind of quit.
Now, Jamie, you and I have had previous conversations where we've discussed the importance of a team and providers like health coaches. I wonder what this would have looked like if we were to be able to have those as resources as health coach, because I'm a certified functional health coach, and accountability, guidance, hope, reflecting their strengths, giving them challenges is so important to help them on their journey for success. It would be so interesting to see how that would be if we did have a health coach, because sometimes we know the right thing to do, but what is getting in the way of us actually following through and maybe asking clarifying questions or, intrinsic questions of, what would be possible if you were to be able to succeed in this? And it starts provoking these deeper questions for them. That'd be interesting just to see if, the next study we're able to implement something like that.
I would love to do another study, and I would love to have the help of a health coach, because I agree with you completely. I think if we had done a 3-month study, everyone would have finished.
And what was this? How long was this one?
It was a year-long study. We just slowly lost people over a year. A year seemed to be too long, which also is supported in the data. Serious, it is. I mean, people we know that, right? New Year's Eve, we start out big, and slowly through the year, we lose sight of what those goals were. And we do need support, and I think the people who were successful had a lot of family support. So it was more than one person just out there struggling all on their own. They were working together in family units and friendships and supporting each other to the end. And I think that made a difference. I didn't look at, there were some things that would have been interesting to know, some of the data we didn't collect, like, what made you stay, what made you leave, those kinds of things. That wasn't in the data collection. In reflection, I think that would have been, great to have that.
For creating future studies. Mm-hmm. Now,
I didn't personally have any, just to be clarified with you, I didn't personally have any contact with any participant because I'm representing the sponsor, and I have bias, right? I can't, So it was only the nurses that saw and the doctors that saw, and they were completely separated from me.
And this was a triple blind placebo study, correct?
Correct.
And if you don't mind kind of just breaking that down in layman's terms, what does that mean?
Sure. I love that. It's the gold standard of research clinical research is a triple blind placebo-controlled study. And what it means is that the people on the ground running the study have no idea that when you're giving them, you give them these unlabeled bottles. I wish I would have. I don't have it in here with me, but I have our Windorf bottle. Every bottle that went out looked like the same, and it had Windorf Island research study on it, and then it had an emergency contact number on it, and anyway, that kind of thing. Exactly what was in it, or placebo. So it would say what was in the formula, and it would tell you exactly what was in placebo. So, but you had no idea what you were taking, whether it was placebo or formula. It looks exactly alike. Every capsule looked exactly alike, which in itself, it can be a challenge. And then if you flip over the bottom of it, it's got a lot number on it. That lot number is collected by the manufacturer and by myself, and it's maintained at the university. So let's say someone had some type of side effect. We could look at that lot number and it could go to the university. They would break open the packet. Now, I knew which lots were, but they had a sealed packet there. They could then break open the packet and see if the person was taking a placebo or a supplement. That way, then you would have recourse with ER or whatever to say, yeah, they're having a reaction to this or not. But it was hidden from the people that at the university on the ground to the doctors, to the nurses, to the patient. None of them knew. So it was triple blinded. The only person who knew what the lot numbers were, had open access to the lot numbers, would have been me. And I didn't, of course, tell anybody. That was something I kept here in the U.S. So, and we did.
For the placebos, is that like rice bran? What's inside those? That's exactly capsules?
What's in it. Yeah, and sometimes you have to color it a little bit to make it look. If it has turmeric or cinnamon in it or something that adds color, you'll have to color it a little bit. But that becomes a whole process at the UST, at the manufacturer, trying to make them look exactly alike. So,
yeah, I bet.
But a person would take that either placebo or the product for the entire time, the formula for the entire time. And we just see, did the people who took placebo have any better results, the same as or worse than the people who took the actual product? That way it can't be, I think I'm doing better because I'm taking this and therefore, right? It is totally blinded to everyone.
Okay, so what ended up being the results from this study? So it was a year-long study. Some individuals weren't able to finish. What were some of the results from this?
Well, the results were that the supplement was people who took the supplement decidedly did better. There might be several slides you want to share. I did a presentation on this afterwards. The results were also presented in Grenada to the Ministry of Health and at the medical school in a medical conference. So that's where the results, we did not publish. The university had publishing rights. We, of course, would have been happy to publish, and we have published our results, but not officially in scientific journals because the universities decided that because of the you have to get a certain percentage of completion in your participants in order to publish, and that's why they decided not to.
Is there, what are the implications for them publishing or not publishing? Does it, affect their credibility?
To get it through a journal is very expensive. So that would have been their responsibility. And that's why we've owned all of our studies since then. We've gone through independent clinical research organizations, and we've put the front, we have paid for the cost of publication up front. So we know we're going to.
So that it's not in their control.
Right. When you go through university, the university controls whether they decide to publish or not. And they didn't want to spend the money and time to publish it. So, but we have the results. They're confirmed and they were presented at a medical conference. So we're happy about that.
Okay.
So, basically what it says was that it showed that both maintaining healthy glucose levels and maintaining healthy parameters for a pre-disease population, it showed significant improvement for those who use the supplement. Okay. And then conversely, the placebo group receiving the same gold standard of care. So this is what I loved about this study. Everybody got the gold standard of care, meaning everybody got the education. Everybody got a Fitbit. Everybody had nursing visits and physician visits and labs. So both got the gold standard of care for diabetes in the islands. But the ones who received supplement over placebo did better. So that's what we were excited. Those were the results we were excited to see. It showed significant increase in hemoglobin A1C and an overall decrease in risk factors.
I love that. Like you said, everybody's getting a benefit because we are adding education, lifestyle, movement. But for those individuals who were taking the supplementation, they noticed a greater change.
Yeah. We even did sleep. We even talked to them about sleep, all the risk factors. And there was an education program that was presented every single month when the nurse visited. And that was all lined up. I worked with them at the nursing school and the Visiting Nurses Association, the Grenadian Visiting Nurses Association there. I met with them. We went over the program. It was all the diabetic education that was provided by their clinics. We just took that a step further and paid for that to come into people's homes. Because ultimately, the end was to try and make a difference across the board. And we told people when this study is over, if you've participated in it, we'll give you a year free, glucose stability free. We'll bring the supplies in for you and you can have a year of it for free. So if you were on placebo, you can still benefit from this if you choose to. I don't know how many people actually took advantage of that. However, good story is that we were contacted by one of the physicians who participated in it, and we are now shipping them glucose stability to their clinic because they want to continue using this with their patients. Not only did they love glucose stability and use that with their patients, but they've asked for several of our other product formulas that we are sending to them. They loved our BP stability. They loved our cholesterol. I have a list because I sent that on, and our manufacturing is sending it to them. So this doctor will have access for her patients. It's a woman, fantastic. Female doctor. In fact, I have pictures of her if you ever, because I carried her first box of product over to her so she could have that for her clinic. And now found a way to get those delivered to her directly. Jerron worked with her on that. So kind of exciting to see that this opened a window for somebody in Grenada. She was like, I love this. Great. Now, how do I get these products? So I can actually have them for my patients. So that was a good story.
That's fantastic. So there were some study challenges, which you mentioned. Now, what does this study mean for our consumer?
I think it means that if you are on this journey, if you have risk factors, like myself, for instance, I have risk factors of so many members of my family, I think I've mentioned that before, have suffered with diabetes generationally, that you need to be aware of what your blood sugar is, and you need to this type of glucose stability can do that. It can help you. You have this 30% genetic risk factor. It can help you mitigate that. It can help you keep it down. So taking that daily with your multivitamin would not be a bad thing to do. And you can watch the results. The great thing about glucose stability is you can watch that through your hemoglobin A1C. every 3 months, or when you get your physical.
Or even use a CGM now,
Use
or
your CGM
even if you don't,
watch it
if you
right
can't
there.
get a CGM, use just the regular old school monitor that you can get from the pharmacy.
Exactly. This is something that you can see. Is this going to work for me? We know that the drivers of diabetes are different in different individuals. So I'm not saying across the board that this formula is going to work for everybody, right? But I think for the people it does work for, as a clinician, because I'm a nurse at heart, and when I talk to people who are seeing these profound results in their self-care through the use of our formula, then I am excited for them. And it's just like, we did this huge study, 215 people. I don't know how many people actually went to the university and picked up their free bottles. I don't have that data. But what I do know is one doctor found such a profound effect in her patients that she went through all the trouble to reach out and say, please, let me have access to this product for my patients. I love what it did. I love what it's doing for them now. And I want to bring this to my island. She is actually a native Grenadian, born, raised for generations, and will always be there, and is always seeking, ways to help the people that she works with, her clients, her patients, to have a better life. So a better health life. So, and she feels like our products can do that. So our formulas, she has faith in them. And so one doctor, you always say that it makes a difference to some people, right? And I'm hoping that for those who this will work for, it will make a difference. It will really make a difference. And we do have diabetics who use glucose stability with their diabetic protocol, their diagnosed prescriptive protocol, and they are seeing that they can decrease their load, their medication load, which is great. So when we say, I'm not telling you to go out and just do this. I'm saying work with your doctor, talk to them about there are other people who are doing this. Will you work with me and help me do this as well? Possibly even come off my diabetic medication using this formula. Can you help me do that? I think there are many doctors who would be very supportive of that. And if yours isn't, then you can find someone that will be, right?
Absolutely. So, advocate for yourself. Mm-hmm. Ask questions, inquire. And like you said, if there's a doctor that's not willing to work or collaborate, then maybe look into finding another doctor. And one thing I love so much about what LifeSeasons is doing, again, we're not just using the highest potencies, therapeutic blends, synergistic formulas, clinically tested ingredients. We are going above and beyond, and we want to showcase what nature really does provide and back it up with the science. Just to leave our listeners with, is there any plans or projects for the future that we are working on as far as further clinical studies on some of our formulations?
Oh, yeah, we have a study right now in Canada. We just published one out of Oregon, not on glucose stability. The one in Oregon was on our immunity. Amazing results. Every study we've done since then, we've done pain blocker. Mm-hmm. We have done NeuroQ. We have done RESZ. So every study that we have done since this time has been published in scientific literature, and you can find it. So, and we have it published on our website, so you can go straight to access. It's been, when we're in Health Canada, we definitely go through the whole IRB. That means the ethical process, and and we go through Health Canada, make sure that everything is done properly and done correctly. We're the sponsor, so we're not on the ground running it. We completely hands off. These are placebo-controlled studies. So again, randomized controlled studies. So people don't know whether they're getting placebo or if they're getting the actual formula until it's over. And then, of course, we tell them. And then we collect the data and publish it. So these are done well. they meet the gold standard of, but when I go back to the glucose stability study and what I loved about that original study and why it was written the way it was, is that we wanted to show that we don't believe in that pill for ill. It's not like we're trying to compete with pharmaceutical. That's not the purpose of LifeSeasons. LifeSeasons is there to support you in your health journey and help your body be the best functioning body possible. So when we look at glucose stability, we're saying that this formula was designed to help your body use the glucose the way it was naturally meant to be used. And in the process of a healthy lifestyle, then this can be a huge adjunct therapy to help you move quicker and faster and more efficiently to your health goals. And I agree with you, Niki. I think a health coach is imperative in the journey. You need family, friends, and ongoing help to stay on that journey, because one thing we really learned from this was a year just was a killer for people. Taking a supplement for a year just seemed to be difficult for people, especially when you're not feeling bad. So there are people who can take a multivitamin every day and their vitamin D and they're pretty consistent with it and they do well. And then there's people who struggle with just being consistent. So that's what
that shows.
You can help
exactly
them figure out how to do that.
Yeah. And that shows a big void that we have is the difficulty with consistency and following through with the supplementation. And so how do we change that? Because it's different for every individual. And so maybe that's for a future conversation of how do we create this consistency and build it as a habit. But thank you so much, Jamie, for exploring this study, for doing the work in the field to be able to make these studies happen. It's fantastic. And we know in the supplement industry, backing it up with science is so important, because people can say anything or spill anything in the formulas, but we want to make sure that this stuff works. And that's exactly what we're doing here at LifeSeasons. And I'm excited to explore future studies and pull those apart and see how transformative these products can be.
I just wanted to say one more thing, Niki, if you don't mind. That I think is important. Every time we do these studies, we do safety checks. So for this particular study, we collected on everybody all the way through the end. Whether you were consistent or not, we collected your data. And we showed not one single side effect. And this was taking labs on liver, kidney, blood, so blood sugar, and we had no reported side effects with our supplement, with our formula after a year. So I wanted to be sure that, and some people were on it as long as 300 days, we collected data and no liver or kidney issues. So
I don't know if we can say the same for, absolutely. And I don't think we can say the same for other types of medications designed to have similar effects. And so the fact that we can move the needle further with our blood sugar and our health without having any of these implications is such a phenomenal thing.
Yes. Thank you so much for reaching out and highlighting the study. It was an important study and it's still helping people in the Grenadian islands. So I love that.
Oh, that's so cool to hear. Awesome. Thank you so much, Jamie. We'll chat with you next time.
Yes. Bye-bye, Niki.
Bye.